877-2888. And remember, if water runs through it, we do it. Mike Scott. Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM. The
before 11 o'clock. Thank you for tuning in. Today's the first day of February, and guess what it is? It is National Heart Month, right?
Yes, American Heart Health Month.
American Health Month. Oh, I didn't know that part.
American Heart Health Month.
I didn't know the whole name. Dr. Emer, Joyce is on the phone. She's an advocate for cardiovascular health and a physician at the cardiovascular medicine department at the Cleveland Clinic. Going to give us some information about how to stay heart healthy. There's a survey that they did that she's got some information that might help us understand our own selves better. Dr. Joyce, good morning. How are you?
I'm good, thank you. Good morning. Thanks for having me.
Oh, you're welcome. Are you in Ohio right now?
I'm in Cleveland, Ohio right now.
All right. And on a daily basis, how many patients? You must see a lot of people, huh?
We see, yes. I mean, the Cleveland Clinic is world-renowned cardiovascular center. We see a lot of patients with heart conditions. And really with this survey, we found that a lot of patients, or a lot of people still know, there's a lot of Americans out there who still know very little about their heart health. So really that's something, education and furthering that knowledge is something that we need to work on, and correcting misconceptions.
Especially if someone is going through a heart emergency, trying to help them not to panic.
Absolutely, that's key. And, one of the first things that we need to do and correct is make sure people know what the typical and less typical symptoms of heart emergencies can be, including a heart attack. So if we go through typical symptoms of a heart attack, we're describing patients who, we're looking for sudden onset of chest pain or pressure in the center of the chest, radiating to one or both arms. It might travel up to the jaw or to the back. Sudden onset of difficulty breathing might also be an indicator of a heart attack. Less common symptoms might include things like nausea and vomiting, and that's something that came across from the survey, that people are not aware that there can be less typical symptoms of a heart attack. So correcting that knowledge is also important.
The one thing that seems to come up a lot when we talk about this is that women and men do not have the same symptoms.
That's correct. In many cases, women and men may present differently. So we talked about those typical symptoms, the chest pressure and pain and the shortness of breath, but it's important to remember the less common or less typical symptoms, which can be more frequent in women, in patients with diabetes and other groups. And they can include things like nausea, vomiting, stomach pain, sweating, palpitations, just not feeling right or feeling like you want to collapse. These are other symptoms that in certain groups also may be heart attack indicators. So it's important for people to be aware of that.
When somebody says they were scared to death, and it's a common expression, but I often wondered if emotions really can set something off. Could a heart attack literally be caused by something emotional? Maybe could even depression cause a heart attack?
It's a good point and a good question. There is a particular heart condition that can be caused by sudden onset of emotional stress, something like losing a loved one or grief or something like a house fire or a robbery. That's typically known as broken heart syndrome. But the vast majority of heart attacks are due to a blockage in one of the arteries supplying part of the heart muscle wall. And typical risk factors for this typical type of heart attack really include high blood pressure, high cholesterol, being overweight, diabetes, and smoking. So these are really, we need to reduce our stress, but we also do really need to look at our general risk factors and overall heart health.
In the different businesses that I go into, like my church and the grocery stores, sometimes I see these defibrillators along the wall. How do you know when to use one?
Sure. Well, that's a really important question. And one of the things, equipping yourself with knowledge of how to perform CPR is really essential. And it's something that came through from the survey that just over half of Americans said they did know how to perform CPR, but a much smaller number actually knew the current recommended technique for CPR. So, it's an easily learned skill, and by CPR I mean cardiopulmonary resuscitation, which can involve use of the defibrillators that you're talking about. So really equipping yourself with that skill, how to recognize when someone is having a cardiac arrest, how to use a portable defibrillator, how to respond to that emergency. That can be the difference between life and death. So that's an important area, I think, that we need to focus our education on.
Did the survey reveal anything as far as cultural lifestyles that might cause one segment of the population to have more? And I was wondering if the survey went beyond the borders of the United States.
No, the survey was, primarily performed in the United States. It was built upon really finding out what Americans know about heart emergencies and about things like heart attacks, stroke, cardiac arrest. Given that these, heart disease is the number one cause of death, and these emergencies really are critical to know about. There wasn't so much cultural differences that were investigated in this survey, but an important point that did come across was there is a generational gap. There is a need to educate younger Americans, particularly the millennials, about their heart health and start this education off early.
Are there any annual tests that are given to people about their heart, like men go in for the prostate cancer test once a year, women have mammograms? Is there anything to test your heart?
Sure. Well, one of the first steps is going to see your physician, initially your primary care physician, who will refer you on to your cardiologist, and probably, together with your doctor, really working out what is your risk factor profile, and based on that, the next decision can be made what test to go forward to. There are a number of tests that can be done, such as stress tests, and tests to an EKG test, which is an electrical tracing of your heart. But really, the first and foremost, I think the biggest piece of advice I'd like to say is book that visit with your doctor and discuss your risk and what steps you can take and what might need to be done to risk stratify yourself for your risk of heart disease.
Dr. Emer, Joyce is our guest, and Doctor, we take phone calls. If you are okay with that, I'll hook one of them up with you.
Sure.
Doctor, good morning. You're on the air with Dr. Emer Joyce. Thank you for calling in.
Yeah, good morning, everybody. I had a quick question. Not sure if it's true or if it's a hoax, but by coughing, can you remove a heart attack by extreme coughs? And thank you.
Is that true?
So I just want to clarify the question. Your question was, by coughing, can you relieve a heart attack?
I think he's listening on the radio, and it did sound like that's what he said. And I think I've heard that too myself, by the way.
Sure. So no, that coughing would not be a typical way or a typical treatment to relieve a heart attack. I think it's really important that we get the knowledge out there. What are the first steps to take if you suspect you or your loved one are having a heart attack? And to do this, to get this knowledge out there, Cleveland Clinic has come up with an acronym known as SCAN, SCAN. And if I can just go through each of the letters
Absolutely.
in that
Yes.
acronym. S is symptoms. So remembering those typical symptoms of a heart attack. What most people know, the sudden onset chest pressure, radiating to one or both arms, to the jaw, sometimes to the back, or sudden onset of not being able to breathe properly. But also remembering less typical symptoms like nausea and vomiting, pain in the stomach area. These are also symptoms that need to be remembered. The C in SCAN stands for call 911. And I think most Americans know that, but still, there's still a percentage that think they're going to drive themselves to their doctor's office.
Right.
Or drive themselves to the ER. So absolutely not. Call 911. The next part of the acronym is aspirin. If you have an aspirin to hand, many households do, chew an aspirin. Chew 2 baby aspirin or 1 full dose aspirin if you have it. And chewing just makes it get to the bloodstream earlier and may help to prevent the heart attack progressing further. The final thing you can do if you have it to hand is take a nitroglycerin pill. These are pills that may have been prescribed by your doctor to help open up the blood vessels to your heart. So these are the steps that we would recommend that you take for you or your loved one while you wait for your ambulance. If you think you're having a heart attack.
Wow, that's really good information. Before we run out of time, can I ask you to give us a website or a phone number so that we can get more information?
Absolutely. Please go to clevelandclinic.org/loveyourheart. for a whole host of educational links and information further on the topics we discussed.
All right, good information. You squeeze it in a short period of time, too. Doctor, thank you for being on the air with us today. Keep up what you're doing, and thank you for what you are doing.
Thank you for having me.
You're welcome. We'll be right back.
I'm Chris Foster. A classified memo about FBI surveillance of the Trump campaign last year has been tweaked since the House Intelligence vote to release it. So the top Democrat on that committee, Adam Schiff, says it shouldn't be released now.
Republicans say changes were made to the memo, but only to address grammatical errors and the concerns of the FBI. The agency and the Justice Department have said the memo's release could harm national security.
Fox's Rachel Sutherland. Congressional Republicans are meeting in West Virginia. Their chartered train hit a garbage truck yesterday, killing the driver with 2 other people hospitalized. South Dakota Senator John Thune says
it's a very difficult start to the retreat, obviously, and our hearts continue and prayers go out to the victims, the families of the victims of this very tragic accident.
President Trump's heading to West Virginia to speak at this meeting at a resort in the Allegheny Mountains, 12:30 Eastern Time. Fox News. We report, you decide.
For many businesses, hiring is tough. You want access to highly qualified candidates fast, and you don't want to sign a long-term contract or pay upfront fees. That's why you need Indeed.com, delivering 6 times more hires than any other job site, according to independent research. Indeed is offering new users a $50 credit to give their first job post premium visibility as a sponsored job. Redeem this offer at Indeed.com/credit. That's Indeed.com/credit. Terms, conditions, and quality standards apply.
Are you looking to get out of your timeshare with a 100% guarantee? I'm Karen, owner of Lone Star Transfer. We have helped thousands of timeshare owners get out of their timeshare legally and ethically. We have an excellent track record, and we have an A+ rating with the BBB. Call us today for a free consultation.